Mr. Sanders.
Thank you, Mr. Chairman, and thank you for conducting a hearing on what I suspect is the most serious problem facing the people of the United States. And I think in my own state of Vermont, we have held a number of public hearings in small towns on the health care crisis, and we have been amazed by the number of people who have come out and who have said the present system is no longer working. We need a major overhaul, no more tinkering. We finally must go to a national health care system which guarantees health care to every man, woman, and child. I'm sure that you are familiar with the enormity of the problem. The system is disintegrating. 35 million Americans today have no health insurance. What happens to those people when illness or accident strikes? 50 million people are underinsured, can go bankrupt as a result of a major illness. We rank 22nd in the world in terms of infant mortality. We rank 12th in the world in terms of life expectancy. Is that being number one in the world? I think not. And after all is said and done, for a system which is disintegrating, we end up spending far, far more than any other nation on earth. The Canadians, who are in second place, are spending 30% less than we are. Clearly, to my mind, the system cannot be tinkered with. We need a major overhaul. We need to do what virtually every other nation on earth has done and move toward a national health care system. The proposal that we are bringing forth is, in fact, a Canadian-style system, administratively and politically. As I believe Congressman Russo or Congressman Markey indicated, Canada did not move to national health care full-blown in all of their provinces. It started in Saskatchewan. My own view, and what this legislation proposes, is federal and legal authority, federal aid, increased federal money, and legal authority for those states in the country which are prepared to move forward now with a single-payer system, which is comprehensive, covers all health care needs, universal, covers every man, woman, and child in the state, is portable, allows that insurance to go when people go out of their own state. If the state is prepared to do that, they will receive a block grant which brings together Medicare, Medicaid, and additional funding. As others have indicated, it seems to me to be senseless to move forward without eliminating the private health insurance companies right now, who are costing this country, according to the General Accounting Office, $67 billion in administrative and bureaucratic waste. We no longer can afford all of the billing excess, all of the bureaucracy, all of the legal fees that presently exist. Physicians for National Health Care estimate that the savings would be $100 billion, and they're using more contemporary figures. The fact of the matter is that we can provide health care, comprehensive health care, for every man, woman, and child without spending one penny more than the $750 billion we're presently spending if we take the money out of paperwork, out of bureaucracy, and we use that to provide health care for our people. Now, this issue of health care, to my mind, Mr. Chairman, is not simply a health-related issue. This is an issue of the political credibility of the United States Congress. It is not an accident that in the last election, 65% of the American people did not bother to vote for Congress. The question that the people are asking is, given the enormous problem facing the people of this country in health care and in other areas, is this Congress capable of standing up to the insurance companies, to the drug companies, to the medical specialists, to the medical equipment suppliers, the people who are making billions and billions of dollars off of a system that is disintegrating before our eyes? Now, the beauty of the system that we are proposing is that administratively it allows the states to move forward. And I believe, as someone who was a mayor for 8 years, that I would rather see the single-payer system rest in the hands of the state legislature, of the people of the state, rather than the federal government, which is precisely what goes on in Canada. Also, rather than raising all of the money at the federal level, we give discretion to state governments. California may want to raise their share of the revenue different than the state of Vermont, and we think that's appropriate. Each state should have that option. So essentially what our plan does is provide additional financial help for those states who want to go forward in single-payer, comprehensive, universal care We give those states the discretion of raising their share in the best way that they believe that they can do it. So we think that politically, that is a sensible approach for this body. Because quite frankly, although I've been only here for 6 months, I am not quite sure that tomorrow the United States Congress is prepared to move forward in terms of a shifting of the tax burden to the tune of many, many hundreds of billions of dollars. So we think administratively and politically, single payer administered by the states is the proper way to go. We think it's politically feasible. We look forward to your support. Thank you.
Thank you very much, Mr. Sanders, and I'm pleased that Congressman Gibbons is with us. We were informed earlier he wasn't going to be here. We have your statement already in the record, but we're delighted to have you here to make a presentation to us. We'd like to ask, if you would, to limit the oral presentation to no more than 5 minutes. There's a button on the base of the mic. Please push it forward.
Well, thank you, Mr. Chairman. I think you ought to know historically how we got where we are today and what I think is the solution to the problem. 50 years ago today, I went off to war as a soldier in the United States Army. There was no health care insurance in the United States, no health insurance in the United States. Oh, maybe a couple of union contracts had something like that, but there was really relatively nothing. During World War II, in order to keep down inflation, wage and price controls were imposed upon the workers and businesses of this country. But imposing those controls, they left one door open, and that was fringe benefits. And so during World War II, a system of fringe benefits in order to replace the dollars that the workers weren't getting because of inflation, they built up this private health care insurance system that we now have. It's a historic accident. We have let it grow on, and it is, has brought disaster to our whole health care system. We have not only the most expensive health care system, we have the most clumsily administered system to work with. But we do have one system that works in this country, and one system for which we already have the laws in place. We already have the administrators of the bureaucracy in place. We have all the regulations written, and the people who use it like it. That's Medicare. So my proposal to this Congress is that we extend Medicare to all people, regardless of age, regardless of their status in life. Some of the characteristics that any health care program for the United States ought to have are, first of all, it should be transportable. It should not be job dependent as our current system is. It should be open to all regardless of their current health status or their future health status. And it should be paid for by all. It should be an insurance program just like Medicare is now. Now, why use Medicare? Medicare has 35 million participants already. It has been in existence for 26 years. It works. The hospitals know how to use it, the doctors know how to use it, the beneficiaries know how to use it, all the healthcare suppliers know how to use it, and best of all, we know, or not best of all, but certainly on par with all of that, is that we know how to control cost under Medicare. Unfortunately, under the current Medicare system, we get the most ill people of our population. And therefore, the Medicare cost, or the medical care costs, are higher than they would be for the entire working population. If Medicare is extended to all people, as I propose, then the cost of medical care would be far less in the United States than under the current system. And everybody would be assured that whenever they got sick, or if they needed preventive health care, or advice or counseling, they could go to a doctor or to their provider and get that kind of health care. It is not a radical program. It is not a new program. There would still be some area in there for the private insurance industry if they wanted to sell Medigap insurance to take care of those optional procedures that some people desire, or say a private room or something of that sort over a semi-private room, as we now offer in Medicare. So there are all these kinds of things that make it attractive to America. It is an American program. It is a proven program. It is one that will save money to the average consumer and taxpayer. It is one that will promote better health for all Americans. Unfortunately, most of the Americans who are now not covered by health insurance are children who really can do nothing about it. And most of them are in families where the father and the mother are both working, or at least one of them is working in a job outside of the home. So we have a very vulnerable group of people in America that are not covered. It is estimated that in a year's time, Mr. Chairman, that about 60 million people are not covered by any kind of health care insurance in the United States. Not just 35 million as we see in those snapshots of one time during the year. So we've got a terrible need in this country. We can solve it by extending Medicare to all. We should do it at once.
Thank you very much, Mr. Gibbons. Mr. Gibbons and Mr. Russo, your programs are federally run programs, and Ms. Okar and Mr. Sanders, as I understand it, your programs are federal dollars to go to the states to run the health care system. And Ms. Okar, as I understand your proposal, you would cover not only the acute care costs, but the long-term care costs, as would Mr. Russo. But Mr. Sanders and Mr. Gibbons do not cover the long-term care costs.
Correct. Our plan would cover all. It's a comprehensive plan, as I indicated, covering all health care needs.
It would cover nursing homes and...
yes. Just as the Canadian system does, it would cover all basic health care needs, including long-term care.
Now, you propose to send to the states a certain amount of money that would be the equivalent of what?
Medicaid, Medicare, plus if all 50 states entered tomorrow, which is highly unlikely, there would be a $45 billion increase in federal help for health care to the states. What our proposal does is eliminate the private insurance premiums that we pay, out-of-pocket costs, give the states the savings that a single-payer system would entail. In my small state of Vermont, we estimate that to be $200 million, and then the state itself, through its own tax system, picks up the rest.
Does your bill propose to have the federal government capture the amount of money that would have been spent through the private insurance market, through employers, employees, and then after the federal government captures that money to send it to the states?
Our proposal allows the states the savings that would be entailed in a single-payer system. The states would capture that. The federal government would raise $45 billion.
I'm not talking about the savings. The savings, the argument would go, is that you'd spend less money if you had a single payer.
Right.
But most dollars that are spent in the health care area are dollars that are spent without the government being involved right now. Those are employers, cover their employees, the employers
Right.
and employees.
Private
money.
insurance and so forth.
You're going to have this replaced by a government run at the state level
That's
health
right.
insurance. The money then to fund it, would that be raised by the federal government, including the amount that otherwise would have been spent
The
by the
states would
employer
raise, the people in the state would no longer have to pay all of these private insurance. The state would pick up the tab for that in a way that they felt was best for each individual state.
I see. So the states would then seek to raise the funds, knowing that businesses in that state are not spending the money they had spent before.
Well, we would, that's right, but we would give discretion. Obviously, we expect and would believe in my state of Vermont that we'd raise it as progressively as we could. It would mean that IBM would not have to pay private insurance. They would, in all likelihood, have to pay a higher corporate income tax. Individuals might have to pay
What
other.
protection do you have from the idea that states would be pitted against each other by businesses who would threaten to move if they raise taxes and to try to fund a more generous health insurance
Well,
program?
we think actually it might almost be the other way about in the sense that it makes good sense for business if, in fact, they know that they don't have to pay 20 or 30% more every year for private insurance, which is often the case in my state and around the country. So, in fact, as you know, one of the concerns that business in the United States today has in terms of its competitiveness abroad is they are competing against countries which have national health care. So we think that the approach of national health care is really very sensible for business, and those states that go forward will gain from that.
Cost containment would be different from state to state?
No. What we are doing is, while we're giving discretion to the states in terms of how you would raise your revenue in the same sense that Canada does. Some go for income tax, some go for sales tax, and so forth and so on. My preference is progressive taxation. What we do say is that if a state comes into the program, it must be single-payer, comprehensive, universal, portable, accessible to all. We don't grant discretion on that. We are not saying to one state, hey, you can do it any way you want, another state, you can do it any way you want. We are giving discretion in how you raise the funds, certain administrative issues, but basically it is comprehensive and universal.